All right, hello everyone. Thanks. Hope you're having a good or had a good morning. We're here today on our usual Friday talk. Today's conversation will be on mental health and COVID-19 during the holidays. So we have two experts. One you've heard from before, Lanada Williams. She educated us back in April on this very issue. Well, not during the holidays, but on the issue of mental health during COVID. And then Dr. Nadia Richardson from No More Martyrs, who was one of our, am I gonna get this right, 2018 40 under 40. So with that, I'm gonna go ahead and turn one of our 2017 40 under 40 winners, Mia Keys, who always educates us and gets us right.
And I'm always really excited to be here with the NMQF family, Brandon. Thank you so much. I'm wondering if we can just briefly show off your shirt because I think
it's, yeah.
Yeah, shout out to the one who did it first and bring us to this moment for sure. I couldn't be more excited to be here with two of my really favorite dynamic duo, two of my favorite people on this planet who are just really powerful women in and of they're in their own rights, but then also just a force together in terms of what they bring to the audiences they engage, both in the public light, but then also in a personal light. And on a personal note, I've gone to both Nadia and Lanada have both been present when I've had somewhat of a shakeup of somewhat of a breakdown in thinking about a very close loved one who I lost, who my family lost. And so whenever I think of the two of them, I often think of the moment that we shared and the times that they've been present. So I couldn't be more proud to have Dr. Nadia Richardson with us, who, as Brandon mentioned, is the founder and executive director of No More Martyrs, which is a mental health awareness campaign, which is meant to build a supportive community specifically for Black women. She's an impassioned speaker. And at the time in 2017, when I was working for Congresswoman Robin Kelly, who is the co-founder of the Congressional Caucus on Black Women and Girls, we invited Dr. Richardson to come and just give Congress and congressional staff and members an overview and really just a breakdown of the mental health angst and blues and worries that Black women and girls specifically face. She did a fantastic job, which doesn't really surprise me. She's a very gifted university instructor, and she's developed courses across colleges on diversity, social justice leadership, health disparities and inequities, bioethics, everything that you can really think of in this space. And she's also a member of the UAB Minority Health and Health Disparities Research Community Advisory Board and their Children's Policy Council. So we're very glad and proud to have Dr. Richardson here with us today. Welcome, Nadia. And then we also have with us Lanada Williams, who again is just phenomenal. She's a licensed clinical professional counselor who specializes in family systems therapy, and she is both a mother as well as the CEO of Alliance Family Solutions, which is a private practice located in Northeast DC, which is where I reside. And she's also an acclaimed speaker, author, radio host of her own show, The Lanada Williams Show on BLIS FM. And her purpose, and she'll talk more about that, is to really destigmatize mental health and seeking services. And she does that by narrowing the narrative of counseling through embracing clients in a straightforward, unapologetic manner through acceptance and via a platform of empathy. It's what she embodies. And her approach overall just provides a space where individuals feel welcome, feel loved, and we're talking everyone from couples to families to teen mothers to LGBTQ community members, and all of these people have a special place in their heart. And Lanada can tell you more, but what I do know is that she believes that mental health care should be accessible as a resource, and she definitely uses her platforms, both on social media and otherwise, to find potential clients and to promote wellness. So really excited to be here with them. And I just first and foremost just want to ask you all, how are you? How have you been? What's been going on? It's been quite a hectic and heavy season this 2020 has been.
It has. And I think, I'm doing great. We have good days, we have bad days, we have hectic days. I think in a sense, we're all in that same kind of pocket together. I've been taking a glass half full approach to the whole COVID situation and quarantine and not being able to travel as much as I would like, because by now I would have been to DC a couple of times already this year. So I do miss seeing both of y'all faces, but still trying to do all the work that we do while balancing our new realities, including, for those who are parents, kids who are at home, AKA my daughter's right over here in the corner. But overall, doing well and just trying to stay positive and still make a contribution to the wellness community, the health community, and the education community in the midst of everything that's going on.
Thanks, Nadia. Lanada, how about you checking in?
And I want to thank you for that warm intro. It's so often that we get into these electronic spaces and we're supposed to just perform. So the idea of you just asking how you're doing, how's everything going, I really appreciate that, because it brings a level of warmth to this conversation and empathy that I think is really necessary. So I just wanted to say thank you. And I think that I have been very contemplative. I have really just been in such an awe of how people have started to gravitate towards talking and having these conversations about mental health and being so intentional. So I think that just kind of pausing just to think about all the new people that have come to therapy during this time, everyone that's started to think about their mental health or their well-being, if there are people that are listening that have found a new craft to kind of share and to really think and take the time to just be thankful that people are aware. And health is such an important thing right now. So I think it's brought my awareness of just how my own health is, how I see myself, how I connect with my family. So those have been the things that just have resonated with me during this time of social distancing, and we're in a global pandemic. So, that word pandemic really just has set a tone for 2020 that I just never thought about, so even watching movies, I find myself jealous of watching people in movies that don't have a mask, so just very, very small things that I think that we're still now starting to gravitate towards that we took for granted. So just being fortunate and just being a lot more intentional and aware.
Lanada, I want to stick with that theme of ways that this season and specifically the pandemic has colored how we approach everyday life, so can you both talk to us about how COVID and all of its implications has impacted mental health? And you've already given us a little bit.
Sure, certainly the uncertainty of the day-to-day is really what's throwing off the mental wellness of our country and really the world. Most people have had some level of a routine, but now schools are trying to respond to something that they've never experienced, right? They don't know, should they have the schools open? Should they be closed? I'm even speaking from the university level. I felt like I did a lot of counseling with my students, right? Because they kept asking us for more information. Are we in person? Are we remote? Are we hybrid? And the thing is, it changed on a dime. One moment we were in person, one moment we were remote, one moment we were hybrid, and we couldn't tell them from day to day to day. Even with the end of this semester going into the spring semester, we're not entirely sure because of this new wave and these rising numbers. And that uncertainty and being inundated with information the way that we are, whether it's through social media or our news outlets, really puts us in a place where we have to be intentional about unplugging, right? We have to separate ourselves away from all of these things and become comfortable with the level of uncertainty that we're going to be experiencing at least into the middle of 2021. But that has not been happening right now. So we have been seeing heightened levels of depression and anxiety. And that's understandable. But one of the strategies that we do encourage is unplugging and it's centering yourselves and becoming comfortable with the fact that really no one knows what they're doing fully, and we're doing the best that we can.
Yeah, you speak so very poignantly about all of that. I'm wondering, Lanada, if you have anything to add in terms of, so you mentioned feeling a level of anxiety and even jealousy with the ways that the arts even are reflecting a life that we're mourning. What other concerns with respect to mental health during COVID are people experiencing?
Mm-hmm. I think that, we have put ourselves in a predicament where we have to be overly reliant upon technology. And that we're using that to connect, but we're not really talking about the fact that there's a digital divide that still exists and that everyone doesn't have access to the technology. So we're looking at schools and we're starting to see and kind of uncover these social aspects and these other social dynamics and these other dimensions of wellness are starting to open up that have disparities. So with schools, we're looking at people having hotspots and kids having the technology they need to be able to move forward. And we assumed a lot about the homes. We assumed a lot that people were eating every day and coming home to a meal. We assumed that people were coming home and having someone that could do the level of intensity. I don't know if there's any other parents that are now starting to question their math abilities at the 6th grade level. But like, there are a lot of people who aren't able to keep up with their kids and their homework. And we're becoming teachers at home. We're becoming doctors at home because we're not wanting to walk into urgent cares as aggressively as we were in the past. So it's not only our mental health, but I think our mental health is now hyper focused with also looking at the other dimensions of wellness and how we were really a community. And parts of our community we no longer have access to. And the accessibility is around, it's a life or death experience with this pandemic. So we're talking about very high risk to do things that were very normal. So I think it can be very isolating. Children are wanting to connect with their friends and having to use language. I took, just a walk with my dog outside, and I could hear my neighbors talking to their daughter just about the idea of like, hey, you need to stay away. Like you need to keep a mask on. So we're having to teach and cue our kids to do things in very different ways. I think it's just very isolating. So I think our mental health is something that's always been a question and it's been stigmatized and we didn't talk about it. But now it's a little bit more socially acceptable to say that I'm anxious because it's a pandemic and we all have a generalized level of anxiety just due to the fact that we're not able to connect with each other.
I want to stick with this theme of connection and accessibility, right? And I really want to bring it down to touch, right? I want to talk about touch and warm touch and connecting with neighbors. What does all of that look like right now for you, for other people you've talked to, your clients? And how does, lack of touch or a dearth of touch impact people with respect to mental health? And then I want to specifically talk about how your children are, what kinds of conversation, right now we're also in the wake of serious violence across the nation, right? And when we're talking about protecting each other, parents have the conversation, especially parents of Black and brown children have the conversation, what does all of that look like in terms of what is the conversation with respect to interacting with others, before they leave the house?
I'm glad that you mentioned the violence because I know that we're focusing right now on COVID and the holidays and moods and mental health around the holidays. But the fact of the matter is 2020, it wasn't just the pandemic that was impacting our mental health. It was the racial climate, it was the violence, it was the political climate, it was election fatigue. And that's on top of everyday angst around the Black experience in the United States, right? And the African diaspora even. And then the experiences of Black women having to manage racism and sexism. So we're really talking about mental health in the pandemic, but that's on top of all the everyday factors that impact our mental wellness. And in regards to touch, we do know the science behind serotonin and the need for connection and the need for holding and how, touch and hug and holding hands and physical contact impact and sex for that matter, impact mental health, right, in a positive manner. And we're not having those things. You're hearing single people talk about difficulties dating. You're having church people who do not get to go to church and have that good old church hug. And even for myself, I'm that person that hugs and touches a lot of people. And the balance that I've found, again, is Zoom. You can certainly burn yourself out on Zoom, but because my family is not from here, that's my point of connection, right? I can Zoom into Jamaica, I can Zoom into other parts I can Zoom into Ghana, I can Zoom in and see my family. And so there still feels like there's that bit of connection. As for my friends here, I can still, or I have been, doing some social distance park events, right? But there's still no hug. There's still no, there might be little elbow tap and that kind of thing, but there's still no touch, but you still get that level of connection. And for example, No More Martyrs, with the support groups that we typically offer in person, we've been doing those virtually as well. So there are those points of connections. And children need that outlet. I've been taking my daughter to parks. I've been taking her with one or two friends who I know their parents are following measures of protection. And then I kind of let them utilize technology more than I would typically let her, right? Because I can see the group chat and I can see the group video calls, and I can, because I'm monitoring her phone, I can see these things happen. And I know that that's not as, I wouldn't normally allow that much, but how else are they going to connect? She's missing the bus ride to school. That was her social connection. She's missing lunchtime. She's missing after school care and walking back to the house from the bus stop. She's missing all those points of connections. And we do talk about it, and we do have regular check-ins. And I think it's important to encourage parents to do that, but also encourage parents to have grace on themselves and their students and their children. So Lanada mentioned math. I absolutely had my daughter get a tutor, because there was just, I was like, am I a university professor? What's happening with this 6th grade math? Like, it wasn't working. But being able to check in and have grace on yourself because students are falling behind, having grace on your children because they're falling behind, and having grace on yourself because parental strategies, even now during COVID, are difficult and different. And it might not look like what you think is successful parenting, but it is.
Lanada, any additions to that? Nadia gave us quite.
Yeah, I think she did it was a very robust idea. And I think that the only thing that I think is really nice to point out as a caveat is that not only does the research show that we are wired to be connected, but there also have been studies around how often we should interact. So there was an article that I read around hugging and how often you should either hug your child. So with parents being home right now, they can have an idea that we need to be connected. But scientifically, it looks like for us to be able to move forward, we need to at least have 3 hugs a day. And that is just for us to have a balanced day, just to have a balanced day. For us to be thriving, we need to be at least 5 hugs a day. So if you want to, you can always make a game of it with your kid where you're either walking, you can be in the kitchen, you can be cooking, but just making sure that you're aware and that you count your hugs. So if the baseline just to be at thriving is to say, we're going to go for 5, you can always say that we're going to go for 8 hugs, but just kind of making sure that you are measuring and keeping an idea of how often you're connecting, so that you're able to be very intentional. So you have this time with your kids, or you have this time, either if you're single, you still can always make connections with understanding physically what you need. So it might be that you rub your feet, it might be that you rub your hands together, but you still can get that connectivity to yourself, and it's still a safe way to make sure that you're taking care of those needs.
So glad you shouted out the single folk. I'm really big on washing my hair and just massaging my scalp, right? And it wasn't until I cut my hair I realized how small my head is. So now I can just hit all the parts, and get in there. I also went and got a dog, and my dog and I'm not super touchy-feely with animals in general, but my dog gets all the hugs and love and snuggles. And a lot of times during Zoom calls, he just pops into the room and he kind of gives me the puppy dog eyes. So it matters. I appreciate you mentioning, you both talking about the significance both socially and scientifically with respect to touch. So everyone on the call, I hope that you are monitoring how many good touches you're getting, and on the other side of that, and I want to get to the holiday bit, but on the other side of that, we'd be remiss if we didn't talk about the rise in violence in the home and domestic violence during COVID, right, with bad touches, right? And so I'm wondering if either of you have anything to mention about that.
Well, there's been a lot of different ways that people can connect to safe spaces online. A lot of the websites that are looking for people to reach out They have it so that it's encrypted. There's no password, that you're not able to be traced if you're going to a website. So it's really user friendly for women or men or people that are experiencing some level of domestic violence in the home. So I think that making sure that you know that those resources are there, and coming up with a safety plan for yourself. So it is really hard to plan for safety, especially when you look at the cycle of abuse and when you're in that space where you're romanticizing the relationship again. So it is okay to step back and to come up with a plan for yourself. So if it's writing down who your safe people are, giving an idea of which resources you have, and keeping that information either in the safe space, but it is okay to be planful. I think that sometimes there's an assumption that when domestic violence is happening, everyone wants to leave. So I think it's really helpful and healthy to say that if you are not ready to leave, that still is an okay decision. So you need to think about the levels of safety for yourself. So it's very pressurized to think that people are in a domestic violence and that you should leave. It's very entitled to think, hey, I can flee at any moment, but just making sure that you're really being honest with yourself and being authentic. So there's safe spaces that you can reach out to online. There's support groups, but just knowing that you can pace yourself. I think one thing that resonates is that since there's an assumed level that we have more time, that you should be doing something better with your time. So if you were in the experiencing domestic violence, now is the time to clean your life up and do something different. If you were thriving in your job, now is the time that you go and write a book and do something more. You don't have to do anything. We are already experiencing a level of distress. So just making sure that as people are posting on Instagram, you see some people are remodeling their homes. Some people are really taking the time to do something different. And there are posts that kind of almost shame people and say, well, if you're not utilizing this time, then you're wasting it. So you don't have to feel pressure. Whatever you're doing, knowing that you're okay before this started, you'll be okay when this ends. So if you haven't built a house or written a new book, or started that project that you haven't been able to get to, just give yourself that empathy and the grace that I think Nadia was talking about earlier.
Absolutely, absolutely. And again, outside the pandemic, we do know that domestic violence in the Black community is a serious concern. We do know that Black women experience it at very high rates, that they are not, they are less likely to report. We also know generally that it takes a number of attempts before someone decides to actually follow through with the decision to leave. So I think it's important to be mindful. It's important to remain connected. So again, even though we're not physically seeing each other, to still check in on your friends. Because for those who may be stuck in a sense, like, you know, this is a pandemic, but what if they're furloughed? What if they were laid off? What if they're, you know, their significant other, who is essentially the perpetrator, is the one who is their financial support? Then where are they really going to go right now in the midst of a pandemic? So really checking on friends for other maladaptive coping mechanisms. Are they abusing a substance? We're seeing a rise in substance abuse. We're seeing a rise in alcoholism. We're seeing a rise in other things. So really staying connected to individuals that you care about and looking out for other symptoms that could be a sign of a larger issue like domestic violence. And I would also like to add one other aspect of that is that when we're talking about domestic violence, oftentimes we talk about, you know, we defer to intimate partners, right? But we're also seeing that rise in children. And a lot of that frustration is coming from parents who are burned out and don't have the strategies to have a proper outlet, right, for their anxiety and for their anger and their frustrations and their stresses. That's why parental classes, even during this time, are things that are available. I know our organization has done some work in domestic violence. We are starting some parenting classes with the Housing Authority in Birmingham, Alabama in January, because these are some of the issues that we're seeing arise in the midst of this pandemic.
Yeah, you know, the creativity, that's just the innovation within the healthcare space that's rising up. And with mental health has always been a leading entity with respect to virtual care, right? And it's fantastic that within your line of work, there's an even greater advancement of connecting and recognizing, to both of your points, the empathy that's necessary to provide services to people who want to remain where they are, but they just want their situation to improve, right? So That's fantastic. I'm really grateful to hear all of this work that you all are doing. I want to shift a little bit and get to the heart of our conversation, right? We're leading into the end of the year, coming into the beginning of a new year, and a lot of people become really quite down during the holiday season, right? It's pretty much already started around the Thanksgiving time and leading into now. Wondering if you can first and foremost tell us the difference between the blues in terms of how people feel and clinical mental health related issues, and then also how we can relate both of them to today's conversation. Nadia, I'll pick on you first.
Sure. So I definitely would like for Lanada to speak to some of the specific symptoms. I know seasonal depression is a very serious issue in regards to the change of season. And now, again, we're talking about all of this in the context of the pandemic. Holiday blues are going to be, again, a rise in depression, a loss of interest, a overwhelming sense of sadness that comes about in the holidays, and it can happen for a number of reasons. I've definitely engaged in individuals who are experiencing it because they are going into the holidays because they have lost a loved one, right? And so now when you think about the amount of loss that we've experienced in 2020, how many individuals have lost loved ones to COVID and are now going into the holidays, it's going to be a very tough and difficult process to be joyful and thankful and jolly, right, during this time when you're still mourning the loss of someone to something that you may not fully understand and something that the country is still working to get a hold of. So it could be loss. It could be maybe you're coming from a family environment where the holidays weren't something that were easily celebrated. Maybe you've been furloughed and the things that you were able to do financially, you cannot do for the holidays. Or maybe you're just that person who is so family oriented and now you can't have that large family gathering. And so the difference again, and I'll let Lanada speak a little bit more to this, is that if it goes on for a number of weeks and it really does impact your ability to go about your life, such as work and eating and taking care of family and taking care of yourself, that's when it broaches off into the stage of being something that could be clinically diagnosed and you would really need to seek assistance for. There are also other strategies for something that might be not as diagnosable.
I think that I like that Nadia introduced the term of this having, we interchangeably use terms that kind of define our everyday experience, and calling depression the blues is something that, has a cultural resonance that we all can recognize, but just understanding that there are some nuanced things that happen when we're clinically depressed, that looking at the duration, like how long it's been taking place, and having these feelings that are being characterized. Sometimes we feel rejected, sometimes we feel inadequate. A lot of times for different genders, we feel a lot of guilt and shame, and we don't categorize that as being one of the symptoms of depression. I think too, as we are trying to think about the tasks that we are required to do, some people are still having to work from home. Some people are still having to attend school from home. And there might be a lag in things of getting to work, getting to school. And there's an assumption that since you're at home, you should be able to do these things. So if you're starting to find yourself coming to work a little bit later, you're not able to log on to Zoom every Zoom call. Like, we're getting a lot of exhaustion from having to be on Zoom, ironically enough, for meetings and for all of our other connectivity. So just looking at some of your everyday tasks, if you're starting to not like to do those things or you cannot get to it, then looking for the other symptoms. Maybe you're oversleeping or undersleeping. Maybe you're overeating and not really able to categorize what's happening with that. So using the word depression and knowing that this idea that I feel overwhelmed and I really can't pinpoint it, it is okay to start to think about reaching out to some of the hotlines that are just taking these general calls. So the suicide awareness hotline is a line that people can use just to talk about their symptoms. I think when we hear the word suicide, we automatically think that there has to be something that we are doing to ourselves, like that we want to do, indulge in self-harm. And really that's not the case. So using some of these hotlines just to talk about your symptoms, just to talk about, I really wasn't able to function today, is a start to just looking at your mental health. It's a start to getting the conversation going. And maybe the next step can be that you reach out to a therapist. I think one thing that is happening in mental health, I've noticed that a lot of HMOs are starting to waive the copay for seeing a therapist. And I think that's a great thing because we talked about the systemic changes that we need to see in healthcare, but giving people access. So wherever you are, just knowing that it's okay if you don't want to take a meeting and to take the day off if you have that ability, if you have some sick time, if you have leave and vacation days, not letting those days go by, actually starting to utilize those times and letting your kids too, if because we really haven't highlighted and talked about children, but the idea that now learning is this solo act. If you see your child starting to fall behind in subjects, starting to have missing assignments, instead of internalizing that as a parent and pushing your child to do more, really pausing and talking about the feelings behind that and the why, reaching out to the teacher, making a plan so that they have an advantage or have some outlook that they can reset. Because I think that right now we're all pushing ourselves and we're all doing as much as we possibly can. But these ideas of how depression starts to sink in is when we ignore the symptoms. So just keeping a healthy eye on that and letting the idea of when we're not feeling okay, to express that to someone. And when we're starting to have even signs of ideation, suicide ideation, that we reach out and start to talk to someone slowly so that it's not something that we're just letting compound and build up.
There's my door is opening. I want to eventually show you something that's I'll show you later, but we'll get back to that. I wanted to talk a little bit about, you both mentioned these strategies, right? In terms of addressing the holiday blues and even beyond that, right? I'm wondering though, if you yourself are not experiencing those symptoms, and you just talked about this, Lanada, with respect to recognizing some things in children, how can each of us be supportive to family or friends who we're not necessarily seeing in person, but perhaps they're displaying depressive symptoms? How can we leverage being together while we're apart so that we can show up for one another?
I think one of the things that we try to quickly do is to mirror for other people what we want to see them do. So for example, if you see someone that's struggling, but you're currently in therapy and you are currently taking care of your health, then one thing that I would encourage people not to do is to start to give therapy to their loved ones and to start to have this very clinical conversation and to impress upon whatever you're doing, that person has to mirror and to do. I think that when our family and friends are coming to us and talking about mental health and symptoms, it is okay just to listen. It is okay not to spring into instant action and feel like you have to solve or fix this thing. So I think just giving a pause and just listening. So listening and observing, like, what is this person saying? How can I listen with understanding? How can I be present in this moment? And a lot of times we are thinking about the next thing, like what is the action this person needs to do? What is the action that they need to do to mirror my health and my wellness? So if I'm going to therapy and things are working out for me, I'm like, okay, well, you should go too. Now that's great. We're not saying to not have these conversations where we're sharing what works for us, but in that moment, really to be aware of what is this person saying to me? How can I observe? How can I be present? So it is okay just to listen. And I think that's important to say. We don't have to be the help that our family needs. Our family's asking us to be family in that moment. And it's okay if you pass the number, if you give them a resource, but knowing that you don't have to necessarily be that resource for them.
I think another resource that can help us to not do the same thing that Lanada just mentioned, not try to pathologize, not try to diagnose, not try to be a layperson, mental health professional, to a loved one is to find out what it looks like for somebody to truly be in mental health distress. And that's one of the reasons why No More Martyrs offers mental health first aid training, because it's an evidence-based training to provide anyone with resources and information on how to identify really what it looks like, what the symptoms look like for someone who's in mental distress. The good part about mental health first aid training right now is that it is being offered virtually. So that is still a resource. That's something that individuals can equip themselves with so that they can be more in tune with what it is that they might be seeing in a loved one or a community member. I also agree with what Lanada said in regards to being authentically who you are. Again, with No More Martyrs, you know, I'm Dr. Richardson in all the spaces I go to, but I'm also a Black woman who sees her therapist on a very regular basis. And to be able to speak about that and make space for someone and who is maybe contemplating going to see one, who's trying to work through their own internalized stigma about, you know, about seeing one, to see the benefits of it and know that it's okay. And to ask questions about whether or not they should see a counselor or psychiatrist or a marriage family therapist, and what are the differences between all of these things. So really we can be a benefit to others just by making sure that we're prioritizing our own self-care and that we're not afraid to share that with others.
I truly appreciate that, you know, and I have a follow-up question to that, but I'll pause for a moment. Nadia, can you explain to the audience what mental health first aid is?
Sure, it's an evidence-based training. So in the same sense that anyone can take a CPR class, but they don't have to be a medical professional to save a life, mental health first aid training is the same kind of concept where you learn about depression, anxiety, what it looks like when somebody is having a full anxiety attack, how to engage someone who is experiencing suicidal ideation. And in a sense, you are a sounding board, right? So you're a sounding board, and then you are able to provide words of encouragement and then direct them to the appropriate resources. So you don't stop at just being a sounding board, and you don't stop at just you know, giving them information. You really point them in the direction to and support them in tapping into resources that are available to them. It's a training that started in Australia. It is now worldwide. It has gotten a lot of US support. And again, it's something that I've seen work. I've certainly done this training and then had somebody reach back and say, hey, I approached a woman in a salon who I just, you know, regular passing conversation, really noticed something in her language where it sounded like she needed extra levels of support. And I was able to use the training to ask her questions that ultimately broke her down into tears. So now I have a stranger crying with me, and I can say to them, here are resources, here's information, here's places that you can go. So I've seen it work. I find it very beneficial. And it also, to me, is very empowering, because there are a lot of individuals who want to be of support to those who might be in mental health distress, but they don't feel equipped. They don't know what to say, and they're worried about saying the wrong thing, so they don't say anything at all. So in that sense, mental health first aid is empowering, because it empowers someone to know that if they happen to engage someone who is in distress, they now have an idea of the best ways of supporting them.
And what I will say is both Lanada and Nadia were present on a panel some years back with First Lady of New York, Shirley McCray, who's a really big proponent and champion for mental health first aid. And I very much appreciate her also putting that on the map stateside. So you both talked about how you can help others recognize certain symptoms, or to Lanada's point, giving space for people, being available for those who you recognize symptoms, where you recognize symptoms of distress. What about for those who are supposed to know, right? So healthcare providers, for instance, how can we be more intentional about holding our healthcare providers accountable, not those who are in mental health, but holding our healthcare providers more accountable to recognizing signs of depression, of addiction, of suicide ideation, that kind of thing, moving forward? How can we empower our providers to be on guard?
So I'll actually go back to the mental health first aid training. I've had the opportunity to train community members, do trainings at churches, but I've found that some of the more impactful, most impactful trainings were with people who were professors and medical professionals, right? Because if they are an internal medicine doctor, that doesn't necessarily mean that mental health is at the forefront of what they do in and out of their day-to-day practice. So to really provide them with quick, easy strategies on how to identify and support individuals is one thing. We can hold them accountable in that sense, because that's an easy training to do. Some community clinics have asked us to come in and facilitate those trainings for them. It's a real, it is a time commitment, because in a sense, it's an 8-hour training over a span of time. But again, information is invaluable. I also think that another way of holding our health professionals accountable, just in the sense of minority mental health and, again, specifically Black mental health, is to work through stigma of work through someone's own stigma and biases when it comes to communities that are different than their own. And I say that because there are stereotypes, specifically even of Black women, of being, having attitudes and, being aggressive and angry and just the mad Black woman. But there's research that says that depression in Black women can come off as hyperirritability. And hyperirritability is going to be a Black woman whose fuse is short, right? And if that happens to be the case, then rather than write them off solely as the mad Black woman, the angry Black woman, or whatever in your clinical practices, really tap in and ask what else is going on. And if you are in the position, and if you're trained to do this, because it does take a certain level of training in regards to empathy and bedside manner and culturally responsive care, to really use your voice to set the tone of the engagement. So if even somebody is popping off at you, you could really bring that back in and say, what else is going on? And I've had that experience in advocacy centers, where I've been, cussed inside, upside, overside, down, every word you can possibly imagine. And I'm like, okay, all right, but what's really going on? And how can we talk about it? What do you feel like you need? And once you're able to do that and bring it back and not take offense or write someone off in any particular way, people will break all their barriers down and either cry or at least bring their selves to a place where they can tell you what's really happening. And it's actually a very beautiful thing to watch that ice melt and then connect somebody to the things that they need.
I agree. It's well said. When Nadia was speaking, it really made me realize that it resonated with me that we still have to have these conversations about culturally responsive care in a way that broaches culture and brings culture into the room. And I think that we are still probably within the healthcare profession not doing the best job of creating that space so that people feel like their background and also their personal knowledge, like the personal knowledge that you have about your body, you bring that to your healthcare provider. So I think that there is a way that we can start to bring both of those things to the forefront and know that, we've talked about connections and we've talked about how important they are, but also the connection that culture has with how we move and how we live and how we love and how we connect and what we need from people. So just knowing that, I think that our healthcare professionals can make that easier to tap into that knowledge and asking those questions of how are you doing? Are you okay? One thing that we haven't really touched on, which is now that there is a possible vaccine for COVID, I think that culturally responsive language and making sure that people are that our healthcare professionals particularly have this rigorous training around how important culture is in bringing to the forefront the historical markers that have been systemically disenfranchising people of color, and what we've looked at with different research studies and different vaccinations, and the fear, the historical trauma that's there. And then how do we bring that to the room so that we can talk about how people can heal from this global pandemic, and we can have conversations that are safe for all different types of communities around what this vaccination process looks like. And that is, probably a whole webinar within itself. However, for today, I think just making sure that we don't miss this opportunity to start to ask our human questions so that we can all be authentic and make sure that we're not missing things as we're trying to heal people and heal their bodies, making sure that our spirits are damaged right now too, because we haven't been able to see each other and live in our optimal environment. So just being aware of that and being aware that people bring that tension. Anxiety looks very different for different people. It can come across as being anxious. Nadia talked about people being hypersensitive or hyper aware of people's anger. But our anxiety can be very misleading and present as anger sometimes. For women of color, it can present as shame and guilt. And we can overextend ourselves in these moments and look as if we have more time to do more things and start to ignore ourselves, and justifiably so, because now that we're in the house. So there's an understood idea that you're taking care of yourself because you don't have to leave your home. But it's very important that you keep a schedule and that you are able to put on this schedule as a baseline, what are you currently doing before you start to add or take away from that. So just tracking your own health so that when you do have to meet with your healthcare provider, maybe virtually, you have that data, because they're not able to see and touch and to see be around you. So you have to be your own doctor and bring that data to these conversations that people are having, especially in this virtual time as they're making these appointments and connecting with people.
So I know we are live, but I'm going to share something that's super personal, but it's also relevant to the conversation. I think it gets at the important point that you're making about culturally competent care, but then it also gets at the violence that is associated with this time, and then how much we need one another. So a month and a half ago, long story short, I was assaulted outside of my house. And I live in Northeast DC, and I live in an area that has been in transition for a long time. So I know that the neighbors, in a lot of ways, the neighborhood is grieving in the sense that there's a sense of loss with respect to cultural roots and so on and so forth. But then on top of that, people are really very desperate during COVID. I know that. I know that. I can say that even knowing that my body has dealt with a certain level of trauma over the last month and a half. And what's interesting to me is the way that I know myself enough to know how I respond in situations like that. When it comes to fight, flight, or freeze, I'm fight all the way. I don't know if it's the Philly girl in me. I don't know if it's, but all of that came up. And I remember in the moment where, things were going as they were going. And I was thinking literally in the moment, like, this cannot be the end for me. This is not going to be the end for me. I have to put myself in a situation where I can get to safety, right? So I was literally working my way to safety. And eventually police were called, police came. I did not necessarily feel that in that moment I was cared for as I should have been. And that has since been approached. There have been conversations between myself, my family, and the Justice Department. But in terms of what I needed after, I wasn't as sure what I needed immediately. So when it came to work, when it came to, because you all know I'm also full-time student, and right now I'm in dissertation proposal stage. So when it came to school, I had to say to my professors and to my boss, I need a day. I literally said, I need a day, completely not thinking about the trauma that, that I was dealing with. I needed way more than a day. And what I was very clear on after some time was not only did I need time and space, I needed help in terms of resources for my own mental health. I needed to see my primary care physician who, to your point about cultural competence, I had to let him know what I needed because he was not very attentive to, I went to get checked out so that he could evaluate some things and things could be on record. But I had to tell him what I needed him to do. It was not something that he was forthcoming with. And that was, that made me feel very low in terms of where I felt the healthcare system in that situation, because that's what he represented to me was. And I work for the physicians organization, right? And then there were a number of other things that I thought of afterwards, like I need to be surrounded right now. And for an introvert, that is not my nature. I need the opposite of being surrounded for most of my days. So all of that, I share because there is, and Lanada brought this up before, there is a stigma and shame associated with being very upfront about one's experiences with respect to not just what happens to the body, but the subsequent impact on the mind and on the spirit. I'm very grateful to say that I'm in a much better place and stronger place. I'm grateful that I have such a attentive family who, even in the space of COVID, they did what they had to do so that they could come. And it's only been maybe the last week or so where I've had my house to myself and my dog. And dog came during the midst of all of this as well. So I'm grateful to dog. But I bring all of that up to say that, in our last couple of minutes, all of us are dealing with silent triggers or silent warfare. And we never know how even just a small word or even just one's own presence and light can be healing to others. And, I think that that's just as significant as culturally competent, structurally competent care. But then also making sure that in the aftermath of, to Nadia's point earlier about in the aftermath of situations that bring about the blues, that we're doing what we have to do so that we can be well. And it's not anything you have to explain to anyone, or you can, but we all have to do it. Yeah, so I just share that. There's no question in there, but it's mostly just me sharing. But the question I do want to ask you all is, okay, you're taking care of others, both personally and professionally. What are you doing for yourself? What are some things right now that you're dealing with in terms of keeping yourself well?
So for the purposes of full transparency, I like working, right? I enjoy teaching. I enjoy my students at the university. I love No More Martyrs. And I do both, and I do some consulting work around diversity and cultural responsiveness. And I'm a mom, right? So full transparency, one of the things I'm having to learn to do is once we went to quarantine, right? Once there was COVID and everything, I had to learn to set limits to myself. Because once you're in the house and you don't have anywhere to go, you could work 24 hours a day and just not stop. You could grade, teach, lecture, come out, jump into, for me, No More Martyrs work, advocacy, grant writing, jump out, jump in with my daughter, do some more stuff around the house, and you could really work 24 hours a day. So for me, it definitely, one of the things I'm doing for myself is a clock out time. It might not be 5, it might be more like 7 or 8, but I'm logging out, I'm clocking out, and I'm going to do that work. Mia, I also really want to say thank you for sharing that. As a friend, be calling, but thank you for sharing that because you're really right in regards to storytelling, right? Sometimes we think about storytelling as being something very elaborate, and sometimes it's something very simple, saying, I had this experience, and you don't know, again, who in the room has had a similar experience. With the support groups that we offer through the organization, there are certainly individuals there with a number of different mental illnesses, diagnoses and stuff, but there are also individuals there who are experiencing divorce, who have experienced the loss of a loved one, who have been in car accidents or are having difficulties kind of, working through the anxiety of driving again, individuals who have been assaulted, right? So there's a lot of situational distress and mental health concerns that are resulting from traumatic experiences, and hearing someone share it, and not just share it, but also share what they were able to do to work through it, is probably more powerful maybe than even you think. But it's powerful and it's meaningful. And I think that that's another valuable strategy. And I just wanted to say that as well.
I'm sure there'll be follow-up conversations offline. Which I welcome. And I appreciate all of you in the chat also offering love and healing. And I offer it back to all of us as well, all of us, because we're all going through something that is certainly trying. Lanada, how about you? How are you taking care of Lanada?
You know, I have I've actually been doing a better job of taking care of myself. And I think that I'm hoping that that was part of just an overall journey that I was heading towards before the pandemic started. And I think that it's been very intentional for me to be able to tap into the world of my child, to see him and to get to know him in this very human way as he is learning how to transition to high school, which has been a very, very eye-opening process. And I really parallel it to getting into college in this DC area. I'll also say that. So it is quite, extensive within itself. But I think that I also have been very intentional about reaching out to and making sure that my family and friends feel like they have access to me. So if you calling people back, I have slowly started to pivot from calling people to FaceTiming them unannounced. Welcome by some, not by all, but I'm just getting my own need to be able to see people. So that's been really, really important to me. I mentioned on the last webinar that we were able to have about the fact that I started playing the cello. And that was very intentional too, because it was something that reconnected me to a part of my childhood that I wanted to revisit in a very different way. So I think getting to know yourself and tapping into, I think it's okay for anyone to take in that you're able to sit with yourself and see what are some of your strengths. What are the things that you find joy in? And if you're not able to answer that question, just know that you're not by yourself, because I couldn't answer that question either. But I think that we do have to get into our journey too well. Like, how do we cultivate a wellness for ourselves that we're able to tap into? Like, how can we all cultivate what brings us joy, what brings us smiles, what brings us laughter, and being very intentional about trying to get to those things. And two, forsaking this idea of just being perpetually busy, and being perpetually having to be doing something. So I think when Nadia says, like, having a cutoff time, like having a time where we no longer have to interact, and even if it's for a moment, and this is not to be disparaging to people that have to work, by all means, but even if it's at the super beginning of your day or at the end of your day, but finding some type of time to reconnect.
Yes, to that. I was just getting on a sister friend about that the other day, who was talking about how she's a care provider and has a lot to do, and I support her in that. But I also said, before your day starts on someone else's time, even if all you do is sit up and say thank you, then that's certainly more than enough. I had muted myself. We are at the 1 o'clock hour, and I will just briefly share, because I'd be remiss if I didn't. One of the things that I'm doing, some of the things that I'm doing, I told you all I got a little fur child, so he's running around downstairs somewhere. I'm a huge nerd. All I do is read, and one of my favorite reads right now is actually talks about the blues, but not necessarily from a mental health standpoint, but it's a book that in all transparency, my partner wrote, and it's a beautiful book, and it's called I Don't Like the Blues. It's a book about race, place, and the backbeat of Black life. So it's coming out on the 14th of this month. Brian Foster, he's a professor, sociology down at Ole Miss. Definitely read his book. It is gorgeous work. So lots of reading, lots of walking. And just staying in touch with family as much as I can. So, and including loved ones. So Lanada, Nadia, thank you very much for all that you stand for, all that you brought us today. I certainly look forward to the times where we can go dancing again, Lanada and Nadia, so I'm grieving that, but those times will come. In the meantime, I certainly encourage all of you to make a way and keep yourselves well and stay close to the people you love, especially now. And so with that, I say thank you once again to National Minority Equality Forum for always bringing the good word, to Keiko for putting all of this together, and for Brandon for making it happen. And I turn it over to you, Mr. Garrett.
Oh man, well.
Thank you so much, Mia.
Yeah.
Thank you for having us. Anytime you guys call, you know we're there. We appreciate you so much and miss you. And I miss DC. Miss y'all.
Miss you too.
We miss you too. We don't even get to see each other. I talk to Mia maybe 3 times a week on a video call, but never actually been in the same room. And so, yeah, it's really tough. But thank you for sharing, Mia. Thank you too for sharing as well. And I guess usually the only thing I can say is just remember to take care of yourselves. So everyone have a good Friday, and we'll see you next week.